tax credits for homeowners on Wednesday. We'll look to expand community grants to more than $10 million, and we'll move 67 grants totaling $3.8 million into the county's base budget to provide continuity of services for our residents. We'll be enhancing senior and youth services through programming at our recreation centers. We'll extend the Ride On Fair holiday through September and extend the Seniors Ride Free program to all hours of operation for Ride On and Metro bus service in the county. And we'll provide approximately $24 million for rental assistance and increased funding for year-round shelter services. We'll also continue our commitment to education. The county continues to rank near the top of all Maryland jurisdictions for total per pupil funding. For this budget cycle, more than half the county's tax-supported budget, approximately $2.78 billion, is set to fund MCPS. The council will also fully fund a total of approximately $312 million for Montgomery College. The college budget includes no increases in tuition rates or fees paid by our students for FY22. And the council supporting approximately $1.2 million appropriation for the Kid Museum to expand its operation in the county. The Kid Museum is a learning space that provides hands-on learning that incorporates STEM, art, and culture with skills like creativity and critical thinking. As part of our efforts to reimagine public safety, the police budget eliminates 5 school resource officer positions that were designated for MCPS public middle schools, and the budget resolution will require County Executive Elrich to develop a memorandum of understanding with MCPS to specify that officers can only be called to schools that deal with emergency situations. And lastly, I'm excited to share that the council plans to fund the Office of Racial Equity and Social Justice at an increase of 72% compared to the FY21 budget. This is primarily due to an increase in staffing. So please stay tuned as we finalize the budget over the next week and a half, and tune in next week for all the details. Second, I want to let you know that I'm introducing a bill that will amend the existing internal affairs procedures for our police and expand the reporting requirements for the police department's body-worn camera program. I've been working hard on drafting that bill since March, following the release of a horrible incident that took place in January 2020 between 2 MCPD officers and a 5-year-old boy at East Silver Spring Elementary School. The incident revealed many flaws within our police department and the body-worn camera program. So after finding out about the incident and seeing the video, unfortunately 14 months after the fact, my colleagues and I have been working on policies to ensure that an incident like this never happens again. And this legislation has the key provisions that I think we need to increase transparency in the review of body-worn camera footage, and it will help strengthen our community and police relations. There are a few highlights I'll note in there. First, it requires the department to issue body-worn cameras for any officer who's called into uniform. They shouldn't be sending any officers into uniforms without body-worn cameras. Second, it requires the internal random review of our body-worn camera recordings so we know how our officers are interacting with the public. In the East Silver Spring incident, the incident wasn't quickly reported to the chief, and once it wasn't quickly reported to the county executive, the council, or the state's attorney. We all found out from media reports. So the bill also requires the reporting of investigations to the chief of any investigations that involve a use of force, a child under the age of 18, a potential criminal offense by a department employee, a fatality or serious bodily injury, or potential discrimination or harassment by an employee on the basis of race, ethnicity, national origin, sex, sexual orientation, gender expression, or other factors. And finally, it requires the chief to report all those investigations and files and body-worn camera recordings to the county exec, the county council, and the state's attorney in a timely fashion. So I think it goes a long way in the right direction. We have a lot of opportunity to work on it after the budget in work sessions, but we're introducing it tomorrow to get the deliberative process started. But improving transparency and accountability is important to all of the members of the county council. So I'm looking forward to working with my colleagues, particularly Councilmember Glass, who made some suggestions on this bill, and Councilmember Jawando, who's been outspoken in this area, many others, as well as my colleagues on the Public Safety Committee. Let me turn it over now that we've been joined by Councilmember Jawando. He's also introducing a public safety related bill tomorrow, so I want to give him an opportunity to explain that bill quickly as well. Will?
Thank you, Council President. And good to be with you and the Council Vice President and with the members of the media today, and with Dr. Kroll as well. the council president mentioned how important transparency is and accountability uh, throughout government, but certainly in policing. And one of the things that also came to light, and unfortunately has continued to come to light since the horrible incident with the 5-year-old boy at East Silver Spring, there have been lawsuits filed that are alleging civil lawsuits, a number of claims. That was one case. There was another in which council members were personally served incorrectly, but personally served notice of a lawsuit in the case of the Palma, the Fanon Burhay, uh, killing by police last summer, were personally served at their homes. There's another case that was filed just last week with the Palmas, a firefighter here in Montgomery County whose door was kicked down and was accosted under a no-knock warrant, which are now limited under legislation we passed and I worked on with my colleagues earlier this year. But it brings to mind and to bear that the county attorney's office represents and defends against any claim. And there are a number of settlements that are entered into when cases are not taken to trial. And that's taxpayer dollars. It's funded by taxpayer dollars, the insurance policies. And there's very little transparency. As a council member, I know very little about what has happened in these cases and what the settlements have been and what the cost to taxpayers has been, or who's involved or what the issues are. Councilmember Hucker mentioned in the case of the 5-year-old, unfortunately, we found out over a year later that this happened. And it was just a failure at so many levels for that little boy, but also a systemic failure. And there's more to come as these cases proceed. And so I'm introducing 2 bills tomorrow, but the one I wanted to talk about today is related to settlement transparency. And it's co-sponsored by Councilmember Hucker. And this would make sure that the county attorney reports to both the council and the executive about any settlement that we enter into as a county. And it would require that 4 things are done. One, that the settlement, the report would identify who the claimants are or the claimant, if it's multiple or a single individual, what the dollar amount is that was, or other consideration that was given in this settlement, the nature of the claim. So what was the suit about? What was the settlement? Why was it brought forward? And the county departments or offices involved in the claim. And it's important to note, while this certainly covers police, it covers any government agency in the county, because the taxpayers deserve to know when their money is being spent and then when there's misconduct and what happens. And we need that information so that we can take our responsibility seriously as council members and have proper oversight, and that the community can know as well. So this is an open government tool. I think it complements very nicely. I want to congratulate Councilmember Hucker's bill as well, which I'm going to be co-sponsoring also. But we have a lot to do in this area. And these are 2 steps forward to ensure that the public knows what's happening, why it's happening, and what is being paid out of county taxpayer dollars to settle misconduct claims. So with that, looking forward to continue the work with the Public Safety Committee and reimagining public safety. I'll also be introducing a police training bill tomorrow, but I'll talk more about that tomorrow. So thank you, Councilmember Hucker, and appreciate the opportunity to join.
You bet. Thanks for joining us. Okay, a couple more quick updates. Just a high-level update on vaccination, and I'll leave it to the Council Vice President and Dr. Kroll to elaborate. But we're making a lot of strides in our vaccination efforts to allow the county to reopen. On Friday, we reached the milestone of having 50% of our residents fully vaccinated for the first time. That's a major milestone, and it triggers phase 3 reopening in line with the state of Maryland and lifting a capacity and distancing restrictions for indoor and outdoor businesses. So under the Board of Health regulation we already passed, now that we've hit 50% of our residents being fully vaccinated, phase 3 goes into effect May 28th, which is when 50% of our residents will attain their full immunity against the virus. We're also, good news, expecting that 60% of our residents will have received their first vaccination as early as tomorrow, which means we can move to phase 2 of reopening on Tuesday. That allows most businesses to move to 75% capacity. It eliminates outdoor gathering limits in many areas, and it increases gathering limits indoors to 250 people. I'm grateful to all our residents who have allowed us to follow the science and put up with inconveniences to put public health first, and they're doing a great job of getting vaccinated. but we still have more work to do to ensure that all our eligible residents get their shot. Vaccines for adolescents are now available, of course, for adolescents aged 12 to 15. And it's easier than ever to get a shot. We've extended the hours and allowed walk-in vaccinations at all our county clinics. So please make an appointment or just walk in as soon as possible. I'll leave the other health-related announcements to my colleagues, but as T&E chair, I should mention how cautiously happy I am about the announcement last week by the Federal Highway Administration and MDOT SHA of the new preferred alternative for the 270 and I-95 managed lanes project. We're encouraged by the shift in scope of the plan that will help preserve residences and businesses and the environment, all from Bethesda to Silver Spring, that would have been very negatively impacted by our widening of I-495. I've heard from residents all last week who are very happy about the announcement, and I appreciate the work MDOT has done to put forth a better plan. And I really want to credit the thousands of county residents who either signed our petition or turned out to town halls to make their views known. However, I need to say equally strongly, this doesn't adequately address our concerns for 495 west of Old Georgetown Road and I-270 between Old Georgetown Road and 370. That alternative, as proposed, doesn't align with our master plan visions for those corridors. It undercuts our ability to reach our climate and our transportation equity efforts. And so we'll continue to urge MDOT and Governor Hogan to revisit the needs of this area and propose a 21st century infrastructure plan in collaboration with local governments like ours that's consistent with what our residents want, aligns with Biden-Harris administration priorities, puts transit first, and is focused on moving people and not just vehicles. So let me stop there and turn it over to Council Vice President Albornoz.
Well, thank you, Mr. President. Great overview, and it's good to be joined by our colleague and friend, Councilmember Jawando, this morning. Let me just add a few things to your comments with regards to the public health order. The CDC caught many of us, including members of their own administration, by surprise when making the decision to change guidelines with regards to mask use. Lost in that messaging was that people whom have not yet received the vaccination should continue to wear masks for their own safety and for that of their families. People who have been vaccinated, studies have shown conclusively that the vaccination works and works well. And so for that reason, the CDC determined that it would be appropriate to provide the guidance for our residents of our communities that have received the vaccination to be able to go about. And of course, that led to the governor announcing at 5 o'clock on Friday that the state had rescinded most of their public health ordinances and had significantly adjusted based on the CDC guidelines. As the council president noted, Montgomery County has had a plan in place to tie our reopening to vaccinations for almost 2 months now. And we feel confident in that plan, and we feel confident that it would be unwise to deviate from that plan so close before we actually hit this important milestone. And while we can't give details right now, there will be some adjustments that we will be making to the plan based on both the CDC guidelines as well as the governor's announcement late on Friday afternoon. And we worked over the weekend to make those adjustments, which will be announced later this afternoon in time for us to be able to take up this issue and vote on it on Tuesday. And so there will be some adjustments in the regulations between now and May 28th. But as the council president said again, it's important to make clear after May 28th, because we will have reached this critically important milestone with vaccinations, we will be reverting to the state guidance at that point. But we feel it's important to stick to our plan, especially over these next 11 days, and continue to urge all residents to access the vaccination. The good news is, as Dr. Kroll and his team have continued to lead the way on providing as many entry points as possible and to be proactive at this point to reach out to any members of our community that may be reluctant or for whatever reason hesitant to be able to access the vaccination. And there is clear evidence that children 12 and up are accessing the vaccination at an important rate. which will put us in an even better position moving forward. And I'll just make two final points before turning it over to Dr. Kroll to give more specific information with regards to where our numbers are as a community. You know, we know very deeply that this has been devastating and extraordinarily difficult for our businesses, and has led to significant inconveniences across the board. We know milestones have been missed. We know how difficult this has been for everyone. But we do continue to tremendously appreciate all of our residents and constituents for adhering to the guidance, which we believe has literally helped save lives and has kept us on pace in order for this opening. So I'm sure there will be questions about this, but I wanted to provide some of that context and now defer to Dr. Kroll to provide some additional information.
Thank you. Thank you, Council Vice President Albornoz and Council President Hucker, and welcome to everyone. I want to start by giving my thanks to County Council and to County Executive for this year and their support of HHS and all the other departments that have been working throughout this year to address the needs of the county residents across the county, and to the work that you've done on this budget for this year coming, because we will need that resource and those supports as we emerge from this pandemic. We have ongoing needs for food, shelter, and safety, but also some ongoing and growing needs in promoting the mental health and restoring the mental health of county residents, children, adults, families, and older adults. They've all suffered from the isolation, the loss, the fear, and the grief throughout this year. We can't give back that lost year, but we can certainly work with county residents and our friends and families to make sure that they don't suffer long-term from that loss and that they get back on the path of recovery as quickly as possible. I've mentioned, I think before, that our emergency rental assistance program is entering a new phase, and to this point, we've received over 4,000 applicants for rental assistance. And I just noted that the governor has announced an additional, as part of the recovery funding, the governor has announced an additional $192 million in funding through the emergency rental assistance program to help tenants who've been impacted by COVID-19. So that will be a part of our ongoing effort into the foreseeable future. On the vaccination front, and COVID-19 front, our test positivity over the weekend was 2.51% for the last 7 days, and the new case rate is 6.7. These are state numbers. And to Council Member Albornoz's point, as of May 14th, 50% of Montgomery County residents have been fully vaccinated, which is a special moment and a cause for celebration and recognition of the work of all of the partners who participated in getting us to that point. It has been an incredible journey, but it's also a recognition and acknowledgement of the patience and the resilience of the residents of this county who stood and waited to get a vaccine and who got there as quickly as we could make doses available. It also means that we have a long way to go, and we have not backed away from our effort and our commitment to continue to vaccinate and to get doses into the arms of people anywhere and everywhere we can. On that front, the good news is that between Thursday and this past Thursday and Sunday, the county vaccination efforts across all of our sites exceeded 15,000 people. The better news is that over 9,000 of them were between the ages of 12 and 15, which means that we are reaching out to our youngsters. Our family members are now bringing our younger residents into the county to get vaccinated. And they are doing so in great numbers, and I am proud of our youngsters for coming to get vaccinated, and proud of the team that's actually responded to this need, and expect that we will continue to close the gap and get ourselves to 60%, and no doubt, in no great small measure, due to those 12 to 15-year-olds who are on the ball and coming in. So please, young folks, stay on it. We are going to continue our vaccination efforts for our younger residents this week, and in close partnership with Montgomery County Public Schools, both in having them help and to message to families about vaccination opportunities, and in standing up sites in public schools and asking parents and students in surrounding schools to come to a central location for vaccination. We don't have the capacity to go to every school at this point, but we do have the capacity to stand up sites and invite folks to come in from around the communities. We'll be offering daytime and evening hours as part of that process to accommodate families whose work schedules won't allow them necessarily to get to a site during the daytime. We're also partnering with the independent schools in the area. Stone Ridge has agreed to stand up a vaccination clinic in the near future, and I believe this week. Stonebridge, when Dr. Gales and the team met with the independent schools in the area and asked them to submit a plan, Stonebridge did so right off the bat. And we thank them for the opportunity to partner and bring vaccination into another corner of the county. Some additional good news is that 2/3 of the more than 1,300 homebound individuals that we identified from various sources have been vaccinated. So we are working steadily to vaccinate and bring vaccine to the homes of the 400 or so remaining homebound county residents. Vaccination in homes is a very slow process. When you add travel time, the preliminary screening, actually doing the injection, and the post-vaccination observation, plus saying hello and goodbye and maybe a cup of tea with someone along the way, you can easily take an hour for each household and each person, each family or each household that you go into. It is going to be slow, but we are making steady progress, and we've added weekend staff. We've added weekends staff to help bring those vaccines into the homes, and we're going to be continuing to look at ways to pick up the pace as we go forward. I want folks to know and ask them to continue to be patient. As I said, it's a slow process, but we are getting there step by step every day. I think that as we continue to move vaccination and clinic opportunities deeper into the community, we are grateful for the partners that have worked with us, the churches, the community centers, the landlords and tenants associations who've made it possible for us to bring our FEMA strike teams in and our mobile units in. That is making the difference. As we get closer to that, to folks who've been vaccinated, it gets harder and harder, and we have to take more time and energy. And we appreciate all the work that the community members are doing to help make it possible. We did a vaccination clinic this weekend in a couple of different places, but one of them was we did East County Rec. We were over at East County Rec this weekend. And I stopped by the site to see that. And on Saturday, they vaccinated about 90% of the first doses for children who were 12 to 15. And on Sunday, they were turning out high numbers as well. So I appreciate our partners and all the support that they do, and we will keep going down that path. The last thing I'll speak to and close on is this issue of masks, and we realize that the CDC's announcement created a great deal of confusion and some anxiety. And I've heard from my staff, and I've heard from emails from residents around the county about the confusion and not fully understanding what this means and how do we deal with this. It was a quick move. And our Board of Health, our council is looking at options and guidance, and you've heard that from Council President Albornoz and Council President Hucker and Council Vice President Albornoz, that the Board of Health will be looking at what this means for us as we go forward. We have been asking people for the better part of a year to mask up, to keep their social distance, to stay protected. And we are at the numbers that we're at because people have done that and followed that guidance. So this change is going to be a slow one for some folks. And I think there is no easy way, because there is no easy way to tell at this point without a mask or with a mask who's vaccinated and who is not in public spaces. Each of us is going to have to make a judgment about how comfortable we are being in public spaces, in restaurants and in the community. My hope is that folks will take the guidance and take the advice and guidance and continue to follow the guidance from our local Board of Health on this. That has helped us to get to where we are in terms of our low rates of infection and low transmission rates. We will keep you posted on any updates, and I think that is the way we're going to get out of this is all continuing to stay safe and protect each other until we've gotten 100% of the county vaccinated. So with that, I'll turn it back over to you, Council President.
Thank you so much. 2/3 of our homebound residents. That's really terrific progress. Thanks, Dr. Kroll. Susan, I think it's back to you for the questions.
Okay, thank you very much. That is good news indeed, Dr. Kroll. We have some questions coming in again for the members of the media who are here. If you do have questions, please put them in the chat. Tell us where you're from and who your question is addressed to. Our first question today is from Caitlin Peets from Bethesda Beach. She has a question for the council president and Dr. Kroll. Caitlin?
Hi, good morning still for 2 more minutes. Tom, first, before I dig into my question, you said as part of the policing bill that you were talking about that there would be random reviews of body cam footage. Is that right?
Yes.
Okay. And that is not currently happening, correct?
I've heard conflicting information on that. So I've learned a lot about the program in the last couple months, and regardless of what's happening now, we want to make sure we put that into the law.
Okay, and so then expanding on that a little bit, are there any parameters for how frequently or how often those reviews would happen?
Yeah, I think it's partly a staffing issue, and I'm also learning about where we'll be. I think we'll be meeting with the manufacturer Axon very soon to learn about some of the functionalities of the cameras that I'm not sure we're taking advantage of. So once I get a little, this is just introduction tomorrow. Once we get a little more informed about some of those things, we'd like to make sure we're using all the artificial intelligence and other functionalities of the cameras to review properly this huge amount of data that we collect every year and pull out the things that are most appropriate for manual review. And the bill elaborates on the incidents that result in investigations in those 5 areas that are considered the most serious. So I ran through them earlier. You may want to take a look at that, but there's a lot of triaging to do this properly, to both give us a window into how our police officers are interacting with the public and to pull up the video evidence so that we know about investigations on a much more timely basis than we do now.
Okay, thank you. And then Dr. Kroll, I have a couple of questions for you as well. You said about 9,000 12 to 15-year-olds have been vaccinated thus far. Is that correct?
That's right.
Do you know roughly how many 12 to 15-year-olds there are eligible in the county?
I believe there are in the neighborhood of 20,000, if I'm not mistaken.
Okay, that's a pretty good start. And then talking about the vaccination sites in schools, I know you said not able to do every school, but do you have any idea, how many there might be or any timeline for when those locations might be announced?
So I believe we're doing Argyle Middle School this week, and the site and time, I don't want to say in this venue because I'm not 100% sure, but that'll be posted as soon as we have it and made available to you as soon as we have it. And we'll invite the surrounding community and the schools around Argyle Middle to come and join, to come and be vaccinated at that site.
Okay, thanks so much.
And Caitlin, thanks so much for bringing this all to our attention. So we should be naming the bill after you, but that's probably not allowed.
Thank you.
Thank you, Caitlin. Our next question today is from Dominique Maria Bonesi from WAMU. She has a question for Councilmember Juando and the Council President. Dominique?
Hi, can you guys hear me all right?
Yes.
Yes,
Hi,
we can.
Hi. So I had a quick question, two questions. The first for Councilman Juando regarding the first bill or one of the other bills that you're introducing, which is the community policing bill training. First, why is this bill so crucial right now? And then can you just talk about sort of this part of it that says that it would be continued education? Because my thought is, don't police already have continued education? Isn't there already sort of continued training that they constantly have to do? So you can talk about what is the differentiation? How do you distinguish between what they already are doing and what they're going to be doing?
Sure. Well, I don't want to go too deep. I'll answer your question briefly. We're having a press conference tomorrow about this bill in particular at noon at Montgomery College with Dr. Pollard, who we worked very closely with her and her staff. But look, the issue of training is very important. You have to have, this is a continuum of how do we reimagine public safety, and certainly who we bring in, what they're taught to do, and prioritize, and how they're assessed before they're hired are critical components. The United States of America has the lowest training standards of most industrialized nations as far as their police. It's anywhere between 14 and 30 weeks. We're right in the middle at 24 weeks, 6 months here in Montgomery County. And this bill would add an additional 5 weeks prior to officers being hired. And it would train in areas where they're not currently getting a lot of training: racial equity and social justice, history of policing, communication skills, things there's gaps that lead to devastating consequences. But also for the officers that are on board already, there is continuing education that happens. But again, it's the substance of what the continuing education is. And this would require continuing education in the areas, some of which I just mentioned. And so that's the difference, is that they have to partner with a local education institution, in this case, Montgomery College, to develop those continuing education credits that are related to these issues that are needed in policing and 21st century policing today to reduce disparate contact and disparate death and harm to communities, and improve trust and with the community and police overall. So that's the difference, is that it would be the substance of what's being required to be trained on, as opposed to just having training.
Understood. And then Council President Hucker, on your bill regarding body-worn cameras, does this align with the bill that passed in the state legislature that basically said that counties have until 2023 to implement a review process for body camera footage? I know you guys already have had the body camera policy, so I'm just sort of trying to understand, does this align with what the state has already mandated?
That's a great question, Dominique. You're right. We were one of the first counties to stand up this program, and I serve on the Public Safety Committee, and had actually written a bill that I never had to introduce, because, to his credit, County Executive Leggett and Chief Manger came forward with this proposal to put body cameras on all our officers, and it's been a couple years of funding that and initiating the training and the protocol to do that. We now have to, as far as we know at this point, and we're still getting information about how the new state bill will be implemented, but obviously passed very late in the session. That we have staff looking at that. We think this aligns with that. If it doesn't, we'll amend it. And of course, that state bill, of course, isn't fully in effect yet. So we may have to update this after it goes fully into effect. But no, I think there's nothing in this that isn't out of compliance with that. And at the same time, we don't want to wait for that, because we have a real issue right now, as we've seen.
Thank you.
Mm-hmm.
Thank you, Dominique. Our next question will be from Dario from Telemundo for Councilmember Albornoz. He has questions in Spanish. Dario.
Thank you, Susan. Thank you, everyone. Good morning. Councilmember Albornoz, I have a couple of questions. The first one is, how do you evaluate the vaccination process in the county, especially in Hispanic community? And approximately when the county can lift the capacity restrictions?
Gracias por esa pregunta, Dario. Voy a responder en inglés y en español. Primero en español. El 28 de mayo, porque este viernes pasado llegamos a una fase sumamente importante en la lucha contra la pandemia, en que 50% de nuestra población ha recibido las 2 vacunas. Así que solo tenemos que esperar 2 semanas hasta que esa gente han pasado el periodo donde ya están completamente vacunados. Así que el 28 de mayo el condado va a combinar las reglas con las reglas del estado y de ahí las reglas del condado no van a ser diferentes que las reglas del estado. Y eso es por los sacrificios y el trabajo que ha hecho el Departamento de Salud y Servicios Públicos y también todos los residentes que han trabajado tan duro en este tema tan importante. Así que esa es la buena noticia. Y sí vamos a hacer algunos cambios porque el gobernador anunció el viernes a las 5 algunos cambios a las reglas del estado. Así que va a haber algunos cambios antes del 28, pero tenemos un plan fijo que pensamos que es bien importante y han funcionado muy bien hasta ahora. Y en respecto a la pregunta sobre las vacunas de la comunidad latina, nosotros hemos trabajado con la Iniciativa de Salud Latino y con el Departamento de Salud y Servicios Humanos y también con iglesias y organizaciones comunitarias para tener un plan fijo para dar la vacuna y no esperar que la gente venga al gobierno, al condado, a nuestro sistema, sino más bien ir a las comunidades para poder ofrecer la vacuna en lugares que son más accesibles, en horas que son más accesibles también. Así que nosotros, los números son mucho mejores que son en otras ciudades, pero todavía hay mucho trabajo que hacer porque queremos que la mayoría de gente posible reciben la vacuna. Así que eso es bien importante. So just to summarize quickly, I'll start with the last point first. The county has partnered with the Latino Health Initiative, community-based organizations, churches, and many community-based partners to try and stand up additional vaccination locations that are in more centrally located communities that have been most disproportionately impacted by the virus. And we are also making sure that those locations are accessible, and they've been an important part of the overall strategy. We've made great strides in this area, but there's still some work left to do. But I'm confident that we will complete that work and vaccinate as many people as possible because we know how important it is. And I reiterated our points earlier regarding reopening on May 28th, thanks to the reaching the 50% milestone, and reiterated that we are going to be making some adjustments to the county's health regulations, which we will be announcing later this afternoon and taking up in a vote tomorrow.
Thank you very much, Councilmember Albornoz.
Thank you for your question, Dario. Next, we have Randy Bass from WDVM, and she has questions for the officials who are present today.
Good afternoon. Thanks again for having me on the briefing today. I wanted to ask, would the notification of the executive and the county council about the internal investigations in the police department that fall into those particular categories, would those notifications about those investigations be made public? And would any of the details of those investigations be made public before the investigations are closed?
That's one of the areas we're looking at, and very good question, Randy. We have to work with our county attorney on that, but it'd be my intention to make anything available to the public that there's not a legal constraint, preventing.
Thank you.
Thank you, Randy. Just to make note for folks, the media who are here, Dr. Kroll just put a note that the vaccination at Argyle Middle School will be from 1 to 7 p.m. this Wednesday, the 19th, just in case you need that information. Next up, we have Luis Hernandez from Univision with questions for Council Vice President Albornoz.
Good afternoon. I wanted to see if VP Albornoz can echo a little bit of what Dr. Kroll said in regards to the participation rates of the younger community ages 12 to 15. Especially these numbers are very impressive, of 9,000 out of potentially 20,000 participants during the weekend. If Councilman Albornoz can repeat that in Spanish, we would really appreciate it.
Claro, Luis, ni un problema. Recibimos la buena noticia que más de 9,000 jóvenes desde las edades de 12 a 15, que solo menos de 2 semanas han podido recibir la vacuna, lo han recibido. Eso es importante porque ese porcentaje es mucho más alto que el porcentaje en el resto del país. Y todavía hay muchas citas que ya están planeados para otros jóvenes también. Así que casi más de la mitad de jóvenes ya en esa categoría ya han recibido la vacuna, y con otros esfuerzos esperamos a llegar a más jóvenes encima de eso todavía. Y es sumamente importante el mensaje para padres que por favor registren a sus jóvenes para recibir la vacuna. Es importante para ellos, importante para la comunidad entera.
Just as a quick follow-up, if you can tell us a little bit about the use of masks still in the county, el uso de la mascarilla. ¿Qué mensaje tiene para la comunidad, siendo que la CDC pues dejó un poco de confusión para la región?
Gracias por esa pregunta también, Luis. Es importante notar que si el nuevo consejo del CDC sobre mascarillas es que si has recibido la vacuna, no te tienes que poner la mascarilla en público, y el condado va a dar más información sobre las reglas del condado más tarde esta tarde, porque vamos a dar más información sobre eso. Pero el mensaje es que si no has recibido la vacuna, deberías ponerte la mascarilla si estás adentro, especialmente con otras personas, y afuera también, porque nosotros sabemos que eso es sumamente importante en la lucha contra la pandemia. Las mascarillas trabajan y trabajan muy bien, y si no has recibido la vacuna, por favor, debes registrar para conseguirlo, para que no tienes que ponerte la mascarilla.
And last follow-up, ¿se podrá algún mensaje para los negocios que quieran seguir implementando el uso de la mascarilla dentro de sus instalaciones? ¿Algo que nos pueda adelantar de lo que se va a decidir esta tarde?
Buena pregunta. Nosotros sabemos que es difícil qué hacer. Los negocios no saben qué hacer. Así que nosotros sí vamos a dar información esta tarde, pero los negocios tienen el derecho de establecer sus propias reglas, y nosotros no queremos, si lo quieren hacer, eso está completamente bien por parte del condado, porque nosotros sabemos que empresas tienen diferentes situaciones, así que es importante que ellos tomen esa decisión individual. El condado sí va a dar más información, va a ser bien similar a lo que ha notado el CDC, pero creo que a las 3 de esta tarde vamos a tener más información sobre las reglas nuevas del condado. I'll mention this one in English too, because it's a slight derivation on questions that we received earlier. The question from Luis was, what message do we have for businesses that are understandably trying to adjust to the new regulations, and are they permitted to establish their own regulations? The answer is yes, they are. As private businesses, they are permitted, and the county will not stand in the way of those businesses providing those regulations. And when we update the ordinance later this afternoon, which will be consistent with the CDC guidelines, we will have some additional information regarding what the requirements are with regards to mask use in Montgomery County, consistent with CDC regulations.
Thank you so much. Appreciate it.
Thank you, Luis. Our next question will be from Lillian Moss on behalf of El Tiempo Latino. Lillian.
Good afternoon. Council Vice President Albornoz, we know that schools have the requirement of some certain vaccinations in order for kids to attend to school. What's going to happen in terms of the COVID vaccine? Are they going to be required, or those kids that do not have the vaccine are going to be able to attend to class?
So I'm going to defer to Dr. Kroll, who's probably in a better position to answer with regards to what the plans are initially, and I know they're still developing on whether or not COVID vaccinations will be required for students to be able to come back to school or not. And then I'm happy to try and translate that into Spanish.
Well, the only thing I can tell you, as of this point, no firm decision has been made that I'm aware of on policy regarding the fall. I certainly know that MCPS is wishing to get as many people vaccinated, as many of its children vaccinated as possible. But they have not yet made a clear determination about what the policy is going to be.
Dijo el doctor Krall que no ha anunciado a nuestro sistema de colegios públicos las reglas sobre la vacuna en el año que viene, pero sí hay un equipo trabajando en eso en este momento y va a haber más información más tarde en este verano.
Muchas gracias.
Thank you, Lillian. Council President, I'm going to throw it back to you. That wraps up all the questions for today's briefing.
All right. Well, thanks so much to Gabe and Raymond for joining. Thanks for all your help, Susan. Thanks to everybody for coming. And please come on back tomorrow. We'll have lots more news for you. Thanks. And thanks, Councilmember Jawando. Bye.